The turn of the millennium is an opportune moment to pause, reflect and review. And for India, perhaps a decisive opportunity to review the transformation of a nation which turned itself into a modern, self-governed state over 50 years ago. The powerful role played by the state has perhaps been the most dominant feature of the growth and development of independent India, especially in the provision of critical infrastructure like drinking water, health, education, food supply and transportation. Government statistics abound on the huge level of investments in these sectors. But beneath these impressive figures, do we really know how effectively the infrastructure functions? Are issues of access and availability adequately addressed? What are the problems that citizens face in their interface with these facilities? This is Jalalpur in Gujarat. The women trudge every day to an ashram 2 kilometers away to plead for water. There is a hand pump in the village, but that stopped working over 2 years ago. Mudol in Karnataka has one primary school with one classroom. All the children from the 1st to the 4th sit in the same classroom or in the corridor outside. 2 new rooms were added over a year ago, but they are locked because the contractor has not yet been paid by the panchayat. Rarely are both teachers present in the school. So, for the children of Mudol, reading and writing is a luxury. A graveyard standing next to the public health center possibly explains the reason why the people of Yedira, Andhra Pradesh do not frequent the spanking clean center set up by the government. Is it that? Or the absentee doctor? Is it the rusted equipment? Or the many steps that need to be conquered by the sick and elderly? The cases we have just seen are illustrative of the actual problems faced by people in the access and use of services provided by the government. And for the majority, there isn't even an option.
बोर्ड में पानी नहीं
ಆಮೇಲೆ ಒಂದು ಬಸ್ ಇರೋದು ಒಳಗಡೆ ಆಳು ತುಂಬುತ್ತಾನೆ ಮೇಲೆ ಸ್ಟಾಪ್ ಅಲ್ಲಿ ಹಾಕ್ತಾನೆ
कोई हॉस्पिटल नहीं है यहाँ पे
और राशन में तो कुछ भी नहीं मिलता राशन की दुकान नाम के लिए है
हमारे उतनी कीमत नहीं.
Where are the gaps between government's intention and actual implementation? What is being done to ensure that things work? How can we as citizens demand and get better services? These were some of the questions that were uppermost in the minds of Public Affairs Centre, an independent non-profit organization based in Bangalore. Public Affairs Centre is engaged in both research and citizen action on a variety of public issues.
The centre has facilitated a number of citizen feedback surveys or report cards. These studies have been carried out in close consultation with civil society groups as well as local governments. We have done this work in a number of Indian cities, in Mumbai, in Chennai, in Kolkata to name a few. And we've also done this in different countries like the Philippines, Vietnam and Ukraine. The impact of these studies have been on the local governments. We have a great example for this from the response of Dr. Ravindra, who was chairman of the Bangalore Development Authority when we finished the first report card.
For the first time there was a kind of a feedback from the public about the performance of public agencies like the city corporation, the BDA, the water supply board and so on. So they had assessed, I think, the level of satisfaction that the people derived whenever they visited the offices of these public agencies or the services rendered by them. And my curiosity was triggered mainly by the fact that in the ranking that they had assigned in the report cards, I found that BDA had got the first rank from bottom. It was rated the worst organization. So I thought I should certainly do something about it, because it's kind of a reflection of the people's pulse, I thought at that time.
Recognizing the need for an increased focus on accountability in the management of public services in India, Public Affairs Centre undertook a unique study that evaluates the quality of public services by talking to their actual users, by getting citizen feedback. The Millennial study focuses on 5 basic services on which the government has made huge investments and which are of special concern to the weaker sections of society: drinking water, health and sanitation, education and childcare, public distribution system, and road transport.
By focusing on the basic services that matter most to ordinary people and using the feedback from the citizens on how well the services are performing, we are able to present a comparison of the quality and responsiveness of these services across the states of India.
Our survey had 3 parts. We had a very large and comprehensive survey of users of services. We had direct observation or scrutiny of services across the country. And then we had case studies on how services were performing.
The user survey covered 36,500 households across 144 districts in 24 states. 75% of the sample was from rural India. Over 10,000 observations were collected from different parts of the country on the performance of public services.
Here was a case in which your majority of your sample is going to come from the rural pockets. So we were very keen that we get in touch with somebody who had an extensive network in the rural parts. So we finally selected ORG MARG as the market research agency who would carry out the research on our behalf, the survey on our behalf.
The country was divided into 4 zones: East, West, North and South, and zonal briefings were held for senior research and field coordinators to explain to them how the process was going to take place.
विलेज में जाने के बाद हमारा हाउस होल्ड सिलेक्ट करने का काम होता था। उसके लिए विलेज में जाके पहले एक सोशल मैपिंग करते थे। सोशल मैपिंग हम इसलिए करते थे ताकि किसी भी गांव, पूरे गांव का रिप्रेजेंटेशन हो जाना चाहिए, गांव का कोई भी कम्युनिटी छूटने ना पाए। उसके लिए हमको ये पता करना होता था कि इस गाँव में हैमलेट्स कितने हैं, इस गाँव में कौन कौन सी कम्युनिटी कहाँ पर रहती है। कन्फर्म हो जाते थे कि विलेज पूरा कवर हो गया है। उसके बाद हम देखते थे कि यहाँ पर कौन सी कम्युनिटी बसी हुई है।
एक बात अच्छी थी ये शेड्यूल में कि सभी से उसका रिस्पॉन्स नहीं लेना है। जैसे कि पानी का है, वाटर का है, तो जैसे घर में कोई पानी भरने जाता है तो हम उससे बात करेंगे। फिर ट्रांसपोर्ट का है तो जो जर्नी ज़्यादा करता है, सफ़र ज़्यादा करता है घर में, तो वो उसका आंसर हम लोग उससे पूछे। अच्छा, रेशन का है तो रेशन शॉप में जो जाता है, क्योंकि ये इन्फॉर्मेशन उनको ही मालूम होगा कि उसको क्या एक्सपीरियंस क्या हुआ है, तो वही वो बता सकेगा।
The 5 services were studied on 4 basic attributes: ease of access to the service facility, the extent of actual usage, the quality and reliability of the service, and satisfaction with the service on some key quality dimensions. For every service, each of these attributes was specified. The single most important finding of the survey was that over the last 50 years, governments have made huge strides in expanding infrastructure and improved access to basic facilities all across the country. But quality, reliability and effectiveness of these services leave a lot to be desired. Wherever private sources were available, people seemed to prefer them over public services. Interstate comparisons show that the so-called richer states are not necessarily the ones with better quality of governance. Protected drinking water is a basic service that governments have sought to provide across the country. Over 55% of households in the country had access to protected drinking water from a public source within a distance of 100 meters. Less than a fourth of the population were dependent on non-protected sources which are viewed as unsafe. But having a source of water is not always adequate. Public taps and hand pumps are prone to breakdowns. More than a fourth of the households face breakdowns at least once in 3 months. Community involvement in maintaining publicly used drinking water facilities is fairly high in Kerala and Rajasthan. In Rajasthan, a larger proportion of households conveyed willingness to pay for better services. Even where protected water sources are available, adequacy is a major concern. Only a fifth of the households were fully satisfied with the amount of water they could get. Providing minimum health facilities has been a priority with state governments across the country. Over 40% of rural households had access to a government healthcare facility within a kilometre of their village. The presence of medical personnel at a healthcare facility is critical if timely assistance is to be provided. Around 1/3 of the households reported that doctors were absent at government healthcare facilities when they sought treatment. However, paramedics were more frequently present. Very few were fully satisfied with the behavior of medical personnel. Likewise, with the cleanliness of inpatient wards. Overall, Sikkim, Gujarat and Maharashtra fare better on health services, while Bihar, Andhra and some of the northeastern states are at the other end of the spectrum. Roads and bus transport play a key role in rural livelihoods. But only 2 out of every 5 villages surveyed had tarred roads within their area. Half of the rural households had access to government buses within a kilometre of their village. And wherever private buses were available, they were used more than government buses. Less than 1/4 of the users were fully satisfied with the government bus service. Government bus services were found to be relatively good in Gujarat, Tamil Nadu and Karnataka, but poor in Bihar, Orissa and Assam. Ration shops are an integral part of the safety net for food security. 85% of urban households and nearly 2/3 of rural households have access to a fair price ration shop within a kilometre of their residence. 4 out of 5 households owned ration cards, though this proportion varies across states. However, this does not automatically mean excellent service. More than 75% of the users reported that staple food grain was not regularly available in ration shops. Complete satisfaction with the quality and quantity of food grain supply was less than 10% across the country. The long-term development of the country hinges heavily on spreading literacy and education across India. Over 3/4 of the rural households had access to primary schools within a kilometre of their village. 78% of households with children in school-going age depend on government primary schools. The midday meal scheme has been well integrated with the education system. Many households were aware of the scheme, and almost all who were aware made use of this facility. Full satisfaction with primary schools was, however, limited. Less than a sixth were fully satisfied with the teachers and the infrastructure of buildings. Lack of proper toilets is a major deterrent for girls. Tamil Nadu, Gujarat and Karnataka scored high on the delivery of school education, while Arunachal Pradesh, Tripura and Meghalaya were low rankers.
The results of the Millennium survey vary from state to state. In some states it is shocking, while in others it doesn't come as a big surprise. But the key question is, what next? The government has its task cut out.
Clearly, the government's focus needs to be targeted towards greater and better quality rather than mere expansion of physical availability. Households from weaker sections use government services more than the others. So the quality of these services and any deficiency in service matter more to the poor and marginalized. New ways of service delivery must be tried to reach remote and smaller villages. The experiences of NGOs and corporates would come in very handy, and the entire country would benefit from the sharing of knowledge and best practices of the better performing regions. The Millennial Survey of the State of Public Services in India, the first independent nationwide study on the state of public services in the country, not only provides an independent assessment of the public services, but also establishes a benchmark for measuring their progress and performance over time. The release of the study at the national level and in several states has not only generated an interest in the findings, but have also sparked off debates and a search for answers.
Today we did a real interaction between the government and civil society organizations and trade unionists, educationists, everyone who matters were all there today. So this roundtable will generate a lot of heat within the state.
And I am hopeful that the debates that we will generate in collaboration with citizen groups, civil society institutions in different parts of the country would be heard. It will be the citizens' voice impacting on responses by the government, hopefully improving the quality of governance that we experience in this country.